Hi, everybody. Welcome back to the Faculty Factory podcast. Guess who's back? We have Dr. Neda Gould, the Assistant Professor and Director of the Mindfulness Program at Johns Hopkins, the Associate Director of the Bayview Anxiety Disorders Clinic in the Department of Psychiatry and Behavioral Sciences. Again, right here at Johns Hopkins, recent inductee of the Miller-Coulson Academy for Clinical Excellence. Neda, welcome back to the podcast.
Thank you so much, Kim.
Well, we loved your little snippet on uncertainty and anxiety and coping strategies during these trying times. And I love that you told us to note the facts and drop the story. And it got me thinking again about your mindfulness-based stress reduction course, which is fantastic that you started not only for your patients years ago, but you've recently been offered, actually not recently, it's been a couple of years now, for faculty at Johns Hopkins. And it's been so, wonderfully embraced, and people love learning about mindfulness. And so this is also, I thought, also a good time to get you back on the podcast and talk about some, or guide us in some meditation, maybe do a brief little snippet for folks who are listening, who can, learn about this and maybe do something. What do you think?
I think that's a terrific idea. So I thought the same thing, that instead of just talking about it, we can give people hands-on experience regarding what the mindfulness is. And the mindfulness-based stress reduction course is a program developed by John Kabat-Zinn and highly evidence-based, and it's a terrific class if individuals have time to take it. Either if you're at Hopkins, you can take it with me, or look it up in your community. But, I thought that maybe I can give you a little flavor of what the mindfulness is. It's a little, as you mentioned, a snippet of what the full course would be like. But even practicing some of the mindfulness kind of 10 minutes a day can really make a difference, especially during stressful times. So I thought I'd guide you through a brief breathing meditation, and you can get a sense for yourself of what that practice is like.
Oh, thank you so much.
Sure. And just to clarify with mindfulness that it's a little bit different than relaxation, in that you may or may not feel relaxed during or afterwards. Over the long term, the idea is if you practice regularly, a byproduct does tend to be relaxation. But in the moment, we're allowing our experience to be as it is. And so there might be anxiety or frustration or sadness or pain, and we're making a little bit of space for all of those experiences. And so it's important for people to realize you don't need to feel a particular way, and there's no right or wrong way to do this. We're just cultivating awareness. So go ahead and find a comfortable position for yourself. And you can do this practice seated in a chair or on the floor, lying down if that's more comfortable. And you can gently have your hands resting in your lap, your feet flat on the floor if you're sitting in a chair. And begin by closing your eyes if you'd like, or just having a gaze in front of you. And then taking a few deep breaths. So taking a deep breath in and a long, slow exhalation. And then drawing your next breath in when you're ready. And a long, slow exhalation. And doing this one more time. And with each exhalation, just letting go of where you were a few moments ago, where you need to be later, and just bring yourself to this moment, the only moment that's real. And returning your breathing back to its normal rhythm, and just settling your attention on your breath, noticing that you're breathing. You might find it useful to rest your attention on a part of the breath cycle, maybe at the tip of the nostrils, noticing the cool air as you inhale, and the slightly warmer air as you exhale, or noticing the expansion and contraction of your chest, or the rising and falling of your belly, and just Gently resting your attention on part of the breath cycle. And by now you've probably noticed that the mind doesn't like to stay still. This is perfectly normal. You're not doing anything wrong if the mind wanders. That's just what the mind does. But each and every time you become aware that the mind has wandered, just gently return back to the breath. And that's the heart of the practice. Noticing when the mind wanders and beginning again with the next breath cycle. Allowing each breath to be an opportunity to begin again. Breathing in, breathing out. This moment, this breath. And this moment, and this breath. And the mind wanders, just note in a word where it wandered to. Sound or thought, bodily sensation, and then gently and lightly bring your attention back to the breath. So you can continue for as long as you like with this practice. Otherwise, with this next breath cycle, just notice being with the breath from the beginning of the breath through the middle and to the end. And when you're ready, you can gently open your eyes and take a moment to stretch out. And broaden your attention to your surroundings. And so if you've never meditated before, you can congratulate yourself because you just did. And so even though this concept is can seem intimidating to people, it actually is pretty simple in terms of what you're being asked to do. It's not easy, but it is simple in theory.
Yeah, that is just so wonderful. Friends listening, I'm sure you feel just like me. Isn't she wonderful? Isn't this guided meditation exactly what you need to take care of yourself? We need everyone listening to be strong and healthy, and you need to be strong and healthy. And this is a great example of just, you've not even been doing this for 10 minutes. And I'm sure you have a better sense of cultivating your own awareness and feeling calm and just noticing what your mind and what our brains do. So this has just been so wonderful, Neda. You're great.
Thank you, Kim. You too.
Well, friends in the podcast, you've been just so blessed to be learning from and meditating with and being mindful with Dr. Neda Gould, an assistant professor here at Johns Hopkins, the director of the Mindfulness program and the associate director of the Bayview Anxiety Disorders Clinic. So hopefully you will be inspired. Come back, listen to Dr. Neda Gould guiding you on another guided meditation. It's very easy. You saw how quick that was. Or you will also maybe be encouraged to look up some mindfulness-based stress reduction in your institution or online. But until the next time, please take good care of yourselves. Thank you for all you're doing for our patients and for research and our learners. And just thank you for sticking with it. And we're going to get through this. Thank you, Dr. Gould.
Thank you.
Bye, everybody.